Hi there, I'm Lowen Naturopath at the Highbury Natural Health Centre and IBS Clinic. I'd like to take a few minutes today to talk to you about Irritable Bowel Syndrome or IBS, and I'll try not to be too graphic. You'll find a lot of information on my website, but what I want to point out to you today is how you end up with the diagnosis of Irritable Bowel Syndrome and why the medical system seems to fail you. Mainly it's a matter of time spent with your doctor. Most doctor's appointments will average 6 minutes. That's about enough time for you to describe your symptoms and for him to write a prescription. If it doesn't help, it's enough time to go back and for him to write a referral to a specialist. The specialist has enough time to read the letter and tell you that he'll give you a colonoscopy. After the colonoscopy, while you're in recovery, the specialist has enough time to tell you that there's nothing really wrong. It's probably IBS, maybe you need more fibre in your diet, and go back and see your GP. Now let's compare that scenario with a patient that comes to see me. They tell me they have an upset tummy. I'll spend about 30 minutes asking them questions. When did it start? How often does it happen? What exactly are the symptoms? Have the symptoms changed over time? Who have they seen? What have they done and tried so far? I'll ask about the bowel motions. What form are they? What colour? What is the frequency? Is there any blood or mucus in the motion? Is there pain, bloating, flatulence or wind? I'll ask what they eat and drink and if any symptoms seem to be worse with food. Are there any other symptoms like heartburn or reflux or symptoms that they don't associate with their tummy upset like headaches or skin rashes? Answers to these questions will tell me where the problem most likely is, the severity of it, whether there is one problem area or more, and most importantly, where I can begin treatment to resolve the problem. I'll give you an example of a man who goes to his doctor and he says, "Doctor, I've got diarrhoea." The doctor says, "Well, sounds like IBS to me, you probably just have to learn to live with it." So if he goes to the pharmacist, says to the pharmacist, "Suffering from diarrhoea." So the pharmacist gives him some over-the-counter medication called gastrostop or Imodium, which slows down the colon. This improves things a little bit, but because he doesn't get any further support from his doctor, he just continues to live with the symptoms for about 5 years and then eventually comes to see me. So I start by asking him questions. When does it happen? Oh, about every 3 days. What happens in between? Nothing. No bowel motion. What are the symptoms? Well, it starts with severe crampy pain. First motion's hard and difficult. There's some straining. After about 15 minutes, there's more crampy pain, and then the next bowel motion will be softer. 15 minutes later, I need to go again, crampy pain, and now I've got loose bowels, and 15 minutes later, more crampy pain, and now I've got watery diarrhoea. This can continue for up to 2 hours with repeated trips to the toilet. The next 2 days, in the first thing in the morning, there will be loose bowel motion and then nothing for the next 3 days. The gastrostop or Imodium would stop the diarrhoea after the 4th or 5th trip to the toilet and would prevent it returning the next day. To my way of thinking, this man has a constipated bowel, what I call a plug effect. Here the colon is inflamed and not moving things along as it should. We get an area where it becomes blocked, nothing can pass, more water is drawn into the colon behind the blockage where pressure builds up, creating pain. The muscles then force down around the blockage, creating violent spasms and more pain. The blockage moves, there goes the plug. Then the mass behind will also start to move, ending in watery diarrhoea. This is probably the most common symptom picture that I see in my clinic. For some, it can be so severe that they'll break out in a sweat or pass out on the toilet. This is not just a nuisance, this is a serious condition. In these cases, as with this man, I treat the inflammation in the colon by removing inflammatory foods from the diet, introducing more fibre, and possibly using nutritional and herbal medicine to encourage the bowel to empty regularly every day. Usually, within a few weeks, all symptoms are clear and things are working as they should. So what do I really do? What did I do with this man? I spent time with my patient and I talked to him. If you would like more information, you'll find it on my website, so go to naturalfamilymedicine.com.au or ibsclinic.com.au, and you'll also find my contact details there.